Thanks, Annette, for that kind introduction. And I'm just going to go ahead and share my screen and hope that the virtual magic works. All right, hopefully you're seeing my title slide from evidence to influence research that makes a difference. If not, someone signal to me, but I'm gonna just keep going because I can't see you all now that I'm actually presenting. So thank you so much to Childbright for inviting me here today. I was really excited to come and be part of your, what I think is a celebration of this really wonderful next phase of work for your network. And I was asked to speak a little bit about sort of my own progression because I feel like the progression that your network is making really mirrors actually the progression of my own career. So I'll tell you a little bit about some of our research, our experiences in knowledge mobilization. And then as Annette mentioned, we'll give you a bit of an overview of our Institute strategic plan and yeah, just again, really pleased to be here. So to start, I wanted to reflect a little bit on being a researcher. And as a researcher, I've written a ton of research grants. Many of you have as well. As a researcher, you also have the opportunity to review grants. And now in my role at CIHR, I fund grants. And every single research grant I have ever written, reviewed, or read always begins and ends with a promise. And that promise is that the proposed research will, at some point, improve the health condition that you're studying and benefit patients. We've made incredible gains in our generation of new knowledge in all areas of science. An average of 2.5 million scientific articles are published every year, and global scientific output is doubling in under every 10 years. So it's really impossible to keep up with that literature. 20% of published papers are never cited by anyone, and it's estimated that as many as 50% of published papers are never read by anyone other than the authors who read them and the editors and reviewers at the journal who handled them. A lot of attention has been devoted in recent years, particularly in a lot of areas of science, to the insufficient progress made in translating laboratory-based research into clinical practice. And this discussion is usually focused on the challenge of moving findings from basic science studies to human clinical research studies, and addresses really the first of two gaps along this translational continuum. There is, however, a second and equally important translational step along the research continuum that's often overlooked. And this is the process whereby evidence from clinical research is moved into practice. Various estimates show that it can take as long as 17 years on average for the results of research findings to be adopted into practice. And for those of us who work with children, I mean, that's a whole childhood, right? A whole generation of kids who miss out on the benefits of knowledge that we already have. We also know that it's a very leaky pipeline. Estimates have shown that only about 14% of research ever finds its way into practice or to policy. So what impact does that have across health settings? It's been estimated that 1/3 of patients do not receive evidence-based treatments. Roughly a quarter of patients receive care that is not needed or is potentially harmful. And 3/4 of patients and half of physicians report not having the information they need for decision-making. Gaps between evidence and practice are evidence in my own research area of children's pain. As recent as the 1970s and 80s, it was widely believed that babies, especially premature babies, didn't feel pain and that it was too risky to use anesthetics with them. Babies were given paralytics so that they wouldn't move during surgery, but they were given nothing for pain. And while we've certainly come a long way, there are still many ways that we continue to fail children in pain and their families. Best available evidence is still rarely used in practice. We know that hospitalized children experience an average of 6 painful medical procedures every 24 hours, and over 2/3 of those are done without any pain management, even though there are simple, effective cost-benefit sort of solutions. My own research over the last 25 years has focused on the role of parents in children's pain management. And in this slide, while you see it's the baby getting the needle, it's the father who's feeling the child's pain. And my research program has focused on what parents say and do and how that impacts children's pain. And nowhere have these knowledge to practice gaps been more evident to me as when I became a mother. And over the last 17 years of being a mom, my 4 kids have taken me to the front lines of pain management with their various medical procedures, surgeries, and hospital stays. And I was really shocked to see that all this great science that I had contributed to my entire career wasn't actually being used to the benefit of my own children. There were times where I had to advocate very strongly for my children to receive what I knew to be evidence-based pain management. And my husband is an anesthesiologist. So between us, we are an interdisciplinary pain research team. It made me wonder, what about all of the other children who aren't as fortunate as ours to have parents who are at the cutting edge of pain science? I'll insert a brief cautionary note here about the ever-growing field of e-health. A wide range of e-health interventions have been developed by researchers for pain and many, many other health conditions, with the rationale that they will improve access to care, and many do show promising results in published trials. But the reality is that very few of these e-health tools ever become available to patients. My lab published a paper a couple of years ago that showed that fewer than 30% of e-health tools that had been developed for pain assessment and management in children ever became available to the end users they were intended to help. So the researchers developed them, published an article showing they were effective, but then the tool never actually reached the patients that it was designed to support. Each unused tool, so we interviewed researchers about their tools and what happened to them. Each unused tool cost on average $300,000 US grant dollars, which could be considered to be research waste. And interestingly, researchers who were more likely to involve patients in co-designing their e-health tool were more likely to have tools that actually became available to end users in the end. So just to point out that e-health tools in and of themselves offer no guarantee that the intervention will be made available to patients. The field of dissemination and implementation science has evolved to reduce the gap between research and practice and policy for different knowledge users. And a knowledge user is any person who will use the research results to inform decisions. So this could include patients, caregivers, health professionals, administrators, policymakers, or the public at large. So dissemination is the sharing and spreading of scientific findings, and the use of strategies, implementation is the use of strategies to adopt and integrate science-based intervention to change practice and improve care. Importantly, we can have both dissemination and implementation practice, but we can also have dissemination and implementation science. And I tend to use a broader umbrella term as knowledge translation, or increasingly knowledge mobilization, to refer to this whole collection of activities. Part of the challenge that we have in moving research into practice relates to the metrics we use to measure success in science. These are primarily focused on the number of publications someone has, the number of citations. These are summed up in various statistics like the H-index. But these metrics do not take into account the impact of your research or any assessment about whether your research is even being used. We're at a really exciting time in science because there's been this acknowledgement internationally that we really need to redefine research excellence. And this is a conversation, again, that is happening globally as well as at CIHR. It's really a bit of a trade-off in some ways between rigor and impact, in my view. We absolutely need rigorous science to build our evidence-based approach. But at some point, we need a broader, sometimes messier approach to moving that science into action. In 2012, I had the good fortune of participating in something called the Mayday Pain and Society Fellowship. And this was an outstanding program that provided training to researchers in media, advocacy, and policy. And it was through this program that I learned of the power of social media. And it was a time where science was just starting to kind of acknowledge the potential of social media as a tool in science. And it was during also my fellowship that I learned the power of social media. Up to that point, I was using social media to keep up with friends, from high school, but I've never thought about using it professionally. But the reality is, many of the people that I wanted to reach with, evidence-based information are parents. And social media is one of the most common sources that parents consult for advice and information related to their children. And it's really important. I think a lot of scientists, roll their eyes at social media, but it's really important that we be where parents are going, because if we're not there providing evidence-based information where parents go looking, then they're going to find somebody else. And certainly during this pandemic, we've, observed this catastrophic, epidemic of misinformation. And we're really at a critical time for building back trust in science and science communication if we want our science policies to be effective. As part of my Mayday Fellowship training, I decided I would use social media to start reaching parents with evidence-based information about pain. We created this brief, 2-minute YouTube video that we released on YouTube probably about maybe 8 or 9 years ago. And while it was generally really well received, it was a hard project, because even when researchers do succeed in creating some kind of compelling knowledge mobilization tool, and let's face it, most of the time we don't. We create really boring videos and really boring pamphlets. But even if we do, it's really hard to get it in front of all of the people that you think would benefit from it. So I learned a really important lesson, which was, if you build it, they won't necessarily come. So I started tweeting as a way to try to get it in front of people, and started tagging, influencers on social media like Andre Picard, one of Canada's leading health reporters. I started tagging different parenting groups online like Erica M's Yummy Mummy Club. And because I was tracking the view count on the videos, I could see the number of views on the video rising over time. So I knew that this kind of amplification really was working. This is an example of a blog post that somebody wrote about our video. And again, we had a huge jump in the number of views on the video. So this really kind of opened my eyes to the power of social media. I started tweeting about articles that I had just read. This is one about an article led by a colleague of mine, Samina Ali in Edmonton, where she provided evidence of suboptimal pain management for children in Canadian pediatric emergency departments. I remember I sent this tweet on a Sunday night, and Andre Picard from the Globe and Mail, the health reporter, reached out to me and asked me for a copy of the paper. I was shocked that one of Canada's leading health reporters didn't even have access to the science, because it was hidden behind a paywall. But I sent him the paper. I sent him a few of ours. He wrote me back and said, I'm going to write a story about this. I spoke with him the next day. And then 2 days later, this really powerful story appeared in the Globe and Mail and generated a lot of conversation about the problem of children's pain. So all of this really led me to conclude that, why am I as a scientist trying to do this alone? I really should be working in partnership with people who have expertise in communicating and engaging and making sure evidence was disseminated in effective strategies that were compelling, and not just the ones I had access to. So we applied to CIHR for a knowledge translation program, and we're funded to develop, implement, and evaluate It Doesn't Have to Hurt, a 12-month social media campaign in which we partnered with parents to identify topics in the area of children's pain that parents were interested in and needed to know about. We had a team of researchers who compiled evidence summaries. We had a parent panel who provided guidance and input and really co-created this with us. And then we had our parenting media partner, Erica M's YMC, who packaged all of this content into compelling digital content, YouTube videos, Instagram stories, and pushed it out over their network, reaching millions of Canadian parents each month. This is just one example of one of my favorite social media images. breastfeeding and needles equals it doesn't have to hurt, because this is, literally dozens of randomized trials that have been synthesized into, Cochrane reviews. But what's the take-home message for a parent? Breastfeeding and needles equals it doesn't have to hurt. We were delighted in 2018 to be able to scale up our work to create a national network called Solutions for Kids in Pain. And our goal was to really take this partnership approach to knowledge mobilization that works so effectively with parents and scale it up to all knowledge users in the system.
Canada is a world leader in children's pain research. But did you know it can take up to 17 years for research findings to be put into practice? That's a whole generation of children who miss out on the benefits of information we already know. What we know now is that 2 out of 3 children in hospital undergo painful procedures without any pain management at all. 75% of parents say they don't know how to manage their children's pain. Veterinarians get 5 times more training in pain than people doctors. And only a few Canadian health institutions have made a certified commitment to better pain management. This matters because pain that isn't treated well harms children's brains and bodies, is a struggle, and can be traumatic for families and health professionals, and costs the healthcare system time and money. Scientists have found many ways to manage pain, but most people don't know about these treatments. That's why at Solutions for Kids in Pain, or SKIP, we are working to improve children's pain management across Canada. We are a national knowledge mobilization network that is bringing together researchers, patients and caregivers, health professionals, 48 different health institutions, including all the children's hospitals in Canada, and over 100 partners from around the world. Our goal is to get knowledge about children's pain into the hands of people who need it faster. If you're a scientist or researcher, patient, caregiver, health professional, policymaker, or part of an organization or company with unique expertise or technology, you can help. In fact, anyone can. We all have the opportunity to be a champion for kids in pain. Visit kidsinpain.ca to find out how you can get involved.
So the way SKIP works is that we work closely with patient partners and other stakeholders to identify needs and barriers, and then mobilize solutions to fill these. This is an article that was published earlier this year, led by a PhD student working with me, Nicole McKenzie, in which she analyzed the different kinds of needs and barriers that different groups of people have, and again, highlighting how SKIP has been built around these. SKIP has 4 main knowledge mobilization areas or activities. These include assessing readiness, collating resources and evidence, organizing evidence. The other area we focus on is producing tools, knowledge mobilization tools for children's pain, as well as promoting them and promoting existing tools. We also have knowledge brokers embedded across the country at 5 national hubs to help facilitate institutional change. And we also have an active communications presence and PR strategy to help raise awareness about the problem of children's pain and create a sense of urgency around these issues. This is a pyramid that I love because I think it really captures a lot of what we need to do when it comes to moving research into practice and making sure that research influences practice and policy. There's different strategies, different levers. One is, making it policy wherever you can. So when you make something required, it gets done. When you provide incentives, so when you make something rewarding, it gets done. When you create a sense of community, it makes it normative and it gets done. You also want to provide experience and training, and this makes it easier for people. And then also, there's sometimes a need for infrastructure, and this really helps to make change possible. I wanted to just highlight a couple of kind of key projects that SKIP has had underway. One is that SCIP has developed the first national health standard for children's pain management that will be released in early 2023. And the standard covers a broad age range and population, and really want to credit Dr. Katie Burney at the University of Calgary for her incredible leadership in producing this health standard with the Health Standards Organization, as well as the diverse group of experts and patient partners and equity, diversity, inclusion consultants who've advised creation of this standard. Also wanted to just highlight how SCIP has really tried to be nimble and try to pivot during the pandemic to address significant health issues related to COVID-19, such as vaccination, where there's a significant evidence base and research knowledge. If you want to learn more about SCIP, you can visit our website, and SCIP also recently released its annual report, which summarizes a bunch of all the activities and kind of reach and impact. But this is kind of what I do on the side of a lot of other exciting opportunities and projects in my lab and through at NCE. And as Annette mentioned, I'm also here today wearing my hat as the scientific director of CIHR's Institute of Human Development, Child and Youth Health. And I was really delighted to see Annette mention our new strategic plan that was just launched. We have a lot of information on our website about the strategic plan, including videos. I'll show you one in a moment, as well as tools and social media graphics, and like really a whole suite of tools that you can help to share. And you'll see a strong focus on, the full range of the mandate area for ITSE. So the focus on better beginnings, vibrant childhoods, empowered youth, and our tagline, research that makes a difference. And this work, our strategic plan for the Institute, really does build on a large national initiative that we at ITSE led with colleagues at Children's Healthcare Canada, UNICEF Canada, and Pediatric Chairs of Canada, called Inspiring Healthy Futures. And really this initiative, which brought together over 1,500 diverse organizations and individuals, was launched in 2020 and released in early 2021 in response to the pandemic and a collective need to make sure that the needs of children, youth, and families through the pandemic were not ignored. It also came on the heels of the release of UNICEF's most recent report card that showed that Canada, despite being a wealthy country, and despite all of the incredible knowledge that we have, science that we fund, ranks 30th out of 38 wealthy countries when it comes to children's health and well-being. So the goal of Inspiring Healthy Futures was really to provide a framework that would provide a solution for measurably improving the health and well-being of children, youth, and families across Canada. And we worked really hard to make sure that research was significantly featured. I believe, and I hope you all do with the work that you do, that research is a critical part of moving the needle when it comes to children's health. But unfortunately, sometimes researchers, I think we're often very focused in our own, I say we're passionately niche about our own particular topic, that we don't always engage at the bigger level around how our research connects to improving the lives of children, youth, and families.
We believe that every child deserves the chance to live to their fullest potential. The Institute of Human Development, Child and Youth Health is proud to be one of 13 institutes that make up the Canadian Institutes of Health Research. It's our mission to foster growth and equity across our research community to advance science, promote knowledge and ways of knowing, and address the needs of children, youth, and families in Canada and globally. We convene researchers and partners, champion research in areas of strength and need to build capacity within our community, ensuring reconciliation, diversity, equity, and inclusion across our activities. Our strategic plan focuses on research that promotes better beginnings, vibrant childhoods, and empowered youth within a life cycle context. It was developed in collaboration with many voices and builds on the momentum within our research community to shape a bold vision for the future that puts children, youth, and families at the heart and center of what we do. Visit us online to find out more.
Great. So I'm going to conclude now with that promise that I started my presentation with, the promise that we all make in our grants and in our projects, that our research will at some point help the patients who we've designed it to serve. Never before, I think, has the dissemination and implementation of scientific knowledge been more important. The current unacceptable state of affairs for children across Canada and their families requires deliberate consideration of how research can be better translated into improvements in practice and in policy. We really need to think differently about what we do as researchers and how we can work in partnership with patients, caregivers, and other groups and organizations to make sure that our research moves from evidence to practice and evidence to influence. Don't get me wrong, because sometimes people think, oh, Christine, she's just about knowledge mobilization, implementation science. Absolutely not, because if we aren't generating new knowledge, if we aren't, supporting discovery-based science, then we have nothing to mobilize and nothing to disseminate and implement. So, inadequacies in our current knowledge of all kinds of issues related to child and family health, these gaps remain, and further discovery-based science is absolutely critical. However, the advances that we seek through science and our current public investment in science could be rendered moot unless we also prioritize the dissemination and implementation of this science. So I thank you again very much for including me here today. I want to congratulate Child Bright on this exciting new phase of activity. I've been a big fan of Child Bright for a number of years, and I carefully follow your activities. And so I'm really here today, not only to share sort of hopefully a little bit of inspiration around the importance of dissemination and implementation and knowledge mobilization, but also to really wish you the best of luck because our kids and our families really, really need what you are all doing. So thank you very much to Child Bright.
So thank you, Christine, for that really wonderful presentation. I just want to first thank you for your ongoing support of our network. It is so appreciated. And, being a sponsor of the Inspiring Healthy Futures, it's really that big picture of really looking at children's health and well-being and their families is so important to us, and remembering that, although there is that larger group of children, we are very focused on children with brain-based disabilities who are often forgotten or a particularly vulnerable group. So we appreciate your leadership in looking out for child health in general. In your presentation, you made some really compelling arguments about the importance of not only knowledge generation, but the importance of mobilization and implementation to be sure that great research actually gets enacted and used for better health. And there's so much to learn from your own successes of your research trajectory and the ways you not only generated but mobilized your knowledge for impact. So we're really happy to learn from you, and we appreciate you as our leader in the Institute, and we're looking forward to seeing how the strategies, your strategic plan unfolds over time, and hopefully we'll be able to participate in ways that are meaningful. So I'd like to open it up now to questions. So people, if you have particular questions to ask, you could either use the chat or the raised hand feature. Dan?
Yeah. Thanks,
Just
Christine.
briefly introduce yourself, those who are asking questions, just to briefly introduce, although I'm sure Christine knows most of us.
Yeah. This is Dan Goldwitz, the co-PI for Child Right, and I do everything that Annette tells me to do.
Good move, Dan.
This was a wonderful presentation, Christine. Something that I thought really popped out at me was your comment that you are embedding your SCIP team members into children's hospitals, and I guess you're at some number right now. And I think that's wonderful and key. And I was just wondering, are there good stories to tell from that, or maybe cautionary tales that you've learned? So I just see how that has worked at your end.
Yeah, it's a great question, and nice to see you again, Dan. I think that the knowledge brokers, right, are increasingly being used as individuals who can serve as intermediaries. And yes, we have a number of them embedded in children's hospitals and organizations across the country. And, I think for me, one of the most critical factors in knowledge mobilization and success, around moving research into practice is I've learned that it's really all about relationships. Most things in life are, but I think in science, we are often kind of just trained to kind of share what we've done and sort of have it be really just a push out. When in fact, I think it's about listening. It's about building relationships, building trust. And so I think, having knowledge brokers embedded who can build relationships. And, one of the biggest challenge I think during the pandemic is we intended our knowledge brokers to be regional, but of course everyone became very siloed in some ways within their own institutions during the pandemic. So that sort of more outward reach was difficult. However, when it was possible, the virtual communication, like what we're doing right now, has eroded a lot of barriers that used to be there before. But I would just say, my big take home is for people to really think about relationships. And I do really think part of the problem that we're having around sort of the lack of trust in science right now is that we keep science over here and the public's over here, and we need to increase the dialogue, give up people an opportunity to ask questions and develop relationships. And so I think it's that relationship factor that's really critical, regardless of where you're what kind of people and where they're embedded.
So there's several other questions coming up, but I just want to take this opportunity, as Dan teased me, to thank Dan Goldowitz and Celia Lauer, who is our co-lead for a training program, and Pierre, who have organized a virtual symposium today. So I want to just give a quick shout out. So we have one from the chat, and then we'll go back to raised hands with Simon. So question on the chat was, I'm wondering how you evaluate the impact of the dissemination done via social media.
Yeah, it's a great question. And I'll speak more broadly to how do you evaluate impact, and then, specifically around social media. And I think, this is where that sort of rigor versus impact balance becomes a little challenging. It's absolutely critical that you have, for knowledge mobilization activities, a rigorous sort of performance and evaluation matrix. So you have to think about both your quantitative and qualitative indicators. And, we have a logic model, for example, for SCIP that allows us to kind of properly map on an evaluation framework. So I think in the area of knowledge mobilization, you're really getting into a space where you have to up your game in evaluation. And I think researchers think that research and evaluation are the same things sometimes, because they're not. Evaluation is a completely different skill set. It has a different set of goals. And in fact, you can tell my reading this weekend, a new book that just arrived that I've read rave reviews about, but it's called How Do You Know If You're Making a Difference? A Practical Handbook for Public Service Organizations. So I was really excited that this arrived in the mail. For social media in particular, there are sort of approaches to looking at things like reach, engagement, but of course, you also want to look at, the kinds of people that are engaging, the kinds of messages that are being shared. You can even do analysis of sentiment in social media. So if people have specific questions, that I noticed someone also asking about the pyramid that I showed, feel free to reach out to me. I'll also send along a couple of maybe references and resources that could be shared across the network that I think might be helpful to you at this point.
Thanks so much. That's wonderful. And if any key slides that we could share, that would be wonderful as well. Simon?
Hi, Christine. I'm Simon. I work on the Citizen Engagement Council for Childbright. I'm a patient partner. I think we've met. I love the 17-year, obviously a lot of researchers would know that. I don't know if the public knows that kind of delay from the research to practice, which I get. What I thought was interesting was that the research that a lot of researchers rely on to present or to research, like your slides were from 2008, 2003, 2006, 2013. So I'm wondering if in research, there needs to be research mobilization, because it's almost like if you're doing research based on previous things that are 15 years old, and then we're only getting it 15 years from there, isn't there a gap before we do knowledge mobilization? Am I making sense?
Yeah.
Okay.
Yeah, no, that makes perfect sense. And I think, you know, I mean, we've seen an incredible acceleration in science through the pandemic, and I think that's really exciting. But the reality is, science is a long game. I mean, it takes a long time from the start of a study to, you know, when you can get it through approvals. We know people who get stuck, like getting institutional approvals for years trying to get projects, especially complex multi-site projects launched. So I think, you know, one of the bright spots of the pandemic is that we are really, and part of our strat plan is focused on building capacity. And a key component of our strategic plan is increasing efficiency, because there's a lot of red tape in research, and that's what happens. Things become dated. That said, science is all about building on knowledge, right? And I know this creates a challenge in the public at times. They're like, well, why did opinion change? You know, well, it's because science builds on itself. It's self-adjusting. Someone finds something, then someone finesses it, then someone contradicts it, and that's kind of how it works. But I think you're right. This you know, slowdown of science, which I think the public is not really aware of how long it takes, which I think is partly why there hasn't been as much appreciation of the like incredible, you know, scientific you know, contribution, the rapid vaccines that we received for COVID. Like I feel like that, you know, we've somehow gotten lost in a lot of the other sort of conversations around COVID. But I will say that CIHR has just launched a new series called Health Research Explained. And it's all about trying to kind of better communicate about science and how health research actually works. At the same time, we need to work from within to not make it take so long. We need to get rid of some of the red tape.
So I'm just looking to see if any other questions from the chat or from anyone in the audience. While we're waiting, because we have maybe 2 minutes, and then we'll take a short break. You know, I think there's much more appreciation of this knowledge to action gap, that things take forever to be used, if at all. And so we're excited about this new venture that we're taking in ChildBright in terms of switching gears from generating knowledge to mobilizing and implementing knowledge. And we have really wonderful people involved in our programs to help us with that. But we do see that there is a lack of expertise in child health when it relates to implementation science and mobilization efforts. So I mean, we have wonderful people, but this is something we are struggling with. So we're very pleased to have a very important partnership with the Azrieli Foundation to fund postdoctoral fellows to help build capacity in this area. But I was just wondering with CIHR if this is an area of priority as well.
Yeah, at CIHR, they're actually developing a new knowledge mobilization framework that Alison Borgon, who's the Director General in that space, has been presenting and getting feedback to the different institute advisory boards. But this is something, what you just summarized it as, exactly what we've heard across the child health community, that people want to do more of this, but that there is just not enough experts doing this. And the people who do have this expertise at the early career and mid-career level are in such high demand that they are struggling to be able to kind of spread themselves. So this is something that we are hoping to address. We had 2 knowledge mobilization focus groups this fall with experts to learn more about how could we develop potentially a funding opportunity that would help address this gap. And I know, Annette, that someone on my team is having a conversation with ChildBright, I think in the new year, to talk about, you know, what could we do that would be helpful. So thank you for reinforcing that this is an important area.